Sure. So H.R.1, this is the bill that was passed by Congress, signed by President Trump on July 4th of this year. It does a bunch of things, but the two most salient things that it does that affect our organization and services that we provide the community. The H.R.1 brings an unprecedented cut to the federal Medicaid program. Now, Medicaid is the single largest healthcare program in the United States. It provides access to healthcare for 1 in 5 Americans and nearly 1 in 2 children in the United States.
Hello, everyone, and welcome to this special double release episode for both Only in San Jose and Only in Santa Clara County, your favorite civic ed podcast dedicated to demystifying and democratizing the process of civic participation in local government. My name is Ellina Yin, and I will be your host. Hello, everyone, and welcome back to this special double release episode. If it wasn't obvious, we wanted to do this double release for this episode because it will impact all residents of Santa Clara County, and this includes San Jose. So, our guest for this episode is James Williams. He is the county executive for the County of Santa Clara, a position he has held since July 2023. James began his career with the county in 2010 as a social justice and impact litigation fellow in the office of the county council. He is a first generation American and the first person of color to lead the largest, most diverse county in Northern California. Now, in this episode, we will talk with James on the impacts of H.R.1. And I'm going to read a direct quote from his statement on the passage of H.R.1 dated July 3rd, 2025. The Republican led U.S. Congress has passed H.R.1, incurring massive debt and imposing draconian cuts to fund a multi-trillion-dollar tax cut to the richest Americans at the expense of working families and the most vulnerable. This bill includes the most significant cuts in our nation's history to Medicaid and food assistance, jeopardizing healthcare and food for millions of Americans. And now we are going to hear from James on how HR1 is impacting Santa Clara County specifically and what options we have as a county to protect ourselves from the upcoming budget cuts. Today, we have a very special guest. I'm really excited to talk about HR1, the impacts that's facing our county, as well as Measure A. And James, can you introduce yourself?
Sure. My name is James Williams. I'm the county executive for the County of Santa Clara, and thanks so much for having me on today.
Yes, I'm really excited to dig into this. And before we do, can you tell us just a little bit about how you got into your role and what inspires you?
Sure. I've been with the county now for about 15 years, but have had a passion for public service and local government since a very, very early age. I've held a number of different roles here at the county. I've been the county executive since July of 2023, but was the county counsel, meaning the chief legal officer overseeing our legal department here at the county for the 7 years prior to that. Before that was a deputy county executive overseeing a number of county departments. And before that was an attorney in the county counsel's office. Actually started at the county as a temporary fellow and had no idea I would end up staying here at the county, even though I knew I wanted to work in government, and have just come to love this county organization, what it stands for, what we do, how we take care of people and the people that I get to work with every day. So here I am 15 years later.
Thank you for sharing that. That's something that I notice with a lot of employees of the county that I interview. It's usually a very long career in different departments. And I think that really says something about our county that we have such longevity and commitment, and that people also have kind of that flexibility to explore different paths within the county?
It's an incredible organization. The mission is about taking care of people, and that attracts people to that mission who have not just a head for smart service, but a heart. And when you bring those two things together, it just makes for a special place. And like I said, I've really come to love the county, and it's an honor and privilege to lead this organization. And it's 24,000 dedicated public servants.
Thank you. Well, thank you for your service. I know that city, county employees in general don't get a lot of light. And so I really appreciate all the work that you and all the 24,000 people do for us.
Thank you.
Yes. So, you were talking about the mission of the county. So, I wanted to kind of talk about the role of county government for those listening for the first time who don't understand about how county government connects to public health. Can you explain that for us?
Sure. So counties in California, we're subdivisions of the state. And as I mentioned earlier, counties are about taking care of people. Our core mission is being the social safety net and the delivery of critical safety net services. One whole set of those services are social services and benefits administration, things like child welfare, adult protective services, our welfare benefits, CalFresh, which is we're going to talk about, I'm sure, in a little bit, but that is the California implementation of the federal supplemental nutrition assistance program. CalWorks, which is California's implementation of the national um, uh, supplemental income and welfare programs, and Medi-Cal, which is California's implementation of the federal Medicaid program that provides critical access to health care. So that's one huge facet of what the county does. Another big piece of what this county organization does is the direct delivery of healthcare services. And beyond that, there's such a range of just essential criminal justice, public safety, and what I call the infrastructure that makes our society work. Your birth certificates, your marriage certificates, your death certificates, and everything in between. Property transactions, voting, expressways, that's provided by your county government. But at our very core, it's about taking care of people, especially those in our community who are most in need. And that is the bulk of where we spend our money, where we have our staff, and our focus, mission, and mandate as a subdivision of the state.
Thank you. I appreciate that the breakdown because I think most people it might be a surprise to them to hear that your county government is tasked with your public health and all of us that live within the county.
That's right. And, I think people were a little surprised with the pandemic, but obviously the public health officer and the public health department, that's a county function here in California. And that was something that became very tangible, very visceral for all of us during the pandemic, but it's so much more, right? Every time you go into a restaurant, you'll see that there's a permit with an inspection from the county environmental health department to verify that things are safe. Every time you fill up gas at a gas pump, there's a little sticker from the county sealer who has validated and verified that a gallon from that pump is indeed a gallon of gas. And so every place you look, you will find, if you start looking for it, that little county seal, County of Santa Clara, all throughout your daily life. Like I said, the very basic infrastructure that makes our society work. But especially important for those families in our community who have the greatest need, because our core mission really is to be that social safety net for our society.
Yeah, I definitely remember the pandemic and, getting my vaccine, getting the test, those wraparound lines with our
Yeah.
cars and all that time kind of watching those scenes in Hollywood and then seeing it in real life. And I was so impressed with the logistics and it wasn't chaotic. It was so well organized.
Well, and that's our county healthcare delivery system. So that's one of the things. So the social safety net services I talk about, that's true for all 58 counties in California. But one of the things that makes Santa Clara County unique is we also operate a large healthcare delivery system, Santa Clara Valley Healthcare. We run 4 hospitals and 15 clinics. We have thousands of employees, and we provide direct healthcare delivery services in a way that only a handful of counties in California still do. And this public healthcare delivery system is the reason why, during the pandemic, we were able to provide nearly 2 million vaccinations to Santa Clara County residents at a time when other healthcare providers were not. It's the reason why we were able to provide that testing infrastructure at a time when other healthcare providers in our community could not. And so we have something special that we have built up over uh, literally decades in this county with our public healthcare delivery system and the excellent service that it provides.
Yeah. The more I learn, the more I love my county. I'm born and raised here, born in a Santa Clara County hospital. And so before we get into the impacts of HR1, can you explain really quickly like our funding mechanisms and where that money comes from that
Yeah,
yeah.
absolutely. So Santa Clara Valley Healthcare is special. And like I said, we run 4 hospitals, Santa Clara Valley Medical Center, Regional Medical Center, both of which are trauma centers. They're the only trauma centers in the city of San Jose. We also run O'Connor Hospital and St. Louis Regional Hospital down in Gilroy. And these hospitals and their clinics provide health care directly to about 1 in 4 county residents, but also provide a number of critical and essential healthcare services that impact every Santa Clara County resident. So I mentioned trauma. 80% of all trauma cases in Santa Clara County come to Santa Clara County hospitals. Every 11 minutes, think about that for a moment. Every 11 minutes, somebody is transported by an ambulance to a county hospital. We also provide the only comprehensive burn center in the South Bay. It's one of only 3 comprehensive burn centers between Los Angeles and the Oregon border. We have a rehabilitation center that has yet again been ranked one of the top 10 in the nation. It's the highest ranked rehabilitation center on the entire West Coast. And so these are services. If you end up in a car accident or your family has a severe burn, you never know when these things could happen. Um, will end up at our county hospitals, taken care of by county staff, with equipment and facilities provided by the county, and people don't realize that and recognize that. But the funding for this incredible system is something also that people don't quite recognize. A majority of the funding for Santa Clara Valley Healthcare, it's about a $4.5 billion operation. A majority of that funding comes from the federal Medicaid program, known in California as Medi-Cal, more than 50%. Our second largest funding source is the Medicare program, about 16%. We are actually the largest Medicare provider in this entire community as well. About 13% of the funding comes from commercial insurance payers, and the smallest portion, 12%, comes from local tax revenue. And so one way to really think about it is that about 88 cents on the dollar for this incredible resource for the entire community and all nearly 2 million residents of Santa Clara County. Only 88 cents on the dollar of that is actually from us drawing down external revenue and resources into our system, and about 12 cents matched by local revenues. And so we're able to deliver all these services because of that. But it's because of the Medicaid issues that HR1 has such a big impact on us. I know we'll talk about that in a minute. But we are a huge provider of healthcare services. Like I said, the largest Medicare provider in the county, 750 emergency department visits every day. Our hospitals are busy, all of them, and they provide these critical, literally life-saving services throughout the community.
And in terms of the impacts of HR1 and when it goes into effect, how can residents better understand that timeline?
Sure. So H.R.1, this is the bill that was passed by Congress, signed by President Trump on July 4th of this year. It does a bunch of things, but the two most salient things that it does that affect our organization and services that we provide the community. The H.R.1 brings an unprecedented cut to the federal Medicaid program. Now, Medicaid is the single largest healthcare program in the United States. It provides access to healthcare for 1 in 5 Americans and nearly 1 in 2 children in the United States. And this joint federal state program in California is known as Medi-Cal, and 1 out of every 4 Santa Clara County residents depends on Medi-Cal as their health insurance. 1 out of 4. The HR1 has a whole litany of cuts that it brings to Medicaid. They total nearly $1 trillion nationally. And for our county organization, the impact of those cuts to Medi-Cal and to specific funding streams that affect our public hospital system will add up to over $1 billion a year in lost revenue. Now, you remember I said a few moments ago, we have about a $4.5 billion budget
Hmm.
for Santa Clara Valley Healthcare. Imagine losing over $1 billion of that. That's the magnitude of what we're talking about. It's really an extraordinarily devastating impact. The second big category of cuts in HR1 are to the federal SNAP program. That's the Supplemental Nutritional Assistance Program that provides food benefits to the most vulnerable families. In California, the California implementation of that federal program is called CalFresh. And we have over 130,000 individuals, 130,000 people in our community that depend on CalFresh. Now, these HR1 impacts, there's others as well, but these HR1 impacts are just devastating for those families, for families who depend on CalFresh or depend on Medi-Cal. But they're also devastating because of the magnitude of dollar impact we're talking about on our ability to provide critical services to everybody. Because as I said a few moments ago, Medicaid, Medi-Cal, it's our largest revenue source for Santa Clara Valley Healthcare. These cuts do ramp up over time, but they started already. So we have impacts from HR1 this current year that we're in right now. We are going to be forced and are bringing forward cuts in the health system in the middle of this year. We have a budget process at mid-year. We're bringing forward cuts in mid-year to help balance and deal with the initial tranche of HR1 impacts on our health system. And we have cuts that will escalate over the course of the next 2 years. So there's a big set that come into effect over the next fiscal year. That's the year that begins July 1 of 26. And then another big jump the year after that to the tune of over 500 million in the fiscal year that begins July 1 of 2026, and over $1 billion in the fiscal year that begins July 1 of 2027. So these are huge numbers. It's hard sometimes to understand what that means.
Hmm.
But what that means very tangibly is our ability to maintain and operate these literally life-saving services. Running hospitals and hospital-related services requires significant overhead, significant infrastructure, significant costs, and you have to have the revenue to go with it to sustain that. And so we are facing just an extraordinary fiscal crisis.
Can you share a little bit about the interconnectedness between cities and counties? And because cities don't have hospitals, and so there is a very direct relationship. And I know there's special districts, but there's so many different kinds. And I don't know if there's impact there, but like, what is each city within our county going to be facing as well?
Yeah, the specific areas of greatest cut in H.R.1 to healthcare and food assistance, these are core county related functions. And so from a dollars standpoint, you're not going to see those impacts on city governments or special districts here in our community in the same way. But the reality is these services are all interrelated. And as I mentioned, we operate the only trauma centers in the city of San Jose. You can't have a successful economic development program. You can't have a successful and thriving community without public healthcare infrastructure, without a hospital. If you're one of the largest cities in the United States, which San Jose is, how can you thrive without a trauma center? Um, how can you host um, World Cup and Super Bowl without access to these kinds of critical healthcare services? And so the reality is, even if these particular programs are ones that are operated by Santa Clara County and the county government, they are programs that have extraordinary impacts across the community. I will also just add that our behavioral health services and homelessness related services are significantly funded with Medi-Cal money as well.
Mm.
And there's huge implications there too. And Santa Clara Valley Healthcare is the single largest provider of acute behavioral health services in the community too. So, it's a whole web of interrelationships, and these services are absolutely critical to having a thriving city.
Yeah, I was really surprised to learn when I was looking into like the World Cup, Super Bowl applications is that part of it is you have to have that public health or like, the emergency rooms and all of that infrastructure to even qualify.
Right, right. And here in our community, this is infrastructure that's delivered by the county itself. The other thing that I would just say on HR1 is, from a policy standpoint, these unprecedented cuts, healthcare and food,
Mhm.
were done to help offset the costs of tax cuts. And so there's a lot for people to look into and kind of what HR1 means nationally and what those implications are. Um, but we've never faced in the nation's history this kind of withdrawal of federal support for these critical safety net programs.
Yeah, no, I mean, I guess I'm kind of young, but like in the time that I've been watching government, I have never experienced anything that we're experiencing today with our federal government and the impacts to. Because most of the time, at least in school, what the federal government doesn't always have direct impact right away with local government, but here it's very, very interconnected and is happening very fast.
Very fast, and the magnitude.
Mhm.
These are big numbers very quickly, big policy shifts very quickly. And the speed and magnitude makes it hard for us to pivot and adjust. And that's happening across the country.
Thank you. Okay, so now I think we've reached the end, and so wrapping up, if people wanted to learn more or kind of be a part of the upcoming budget process, where can they? And I'll put some in the show notes as well. But where do you recommend people go if they wanted to learn about this? I also have students who listen to the podcast who think about going into government, and so any advice you have.
Absolutely. So we want people's engagement. We've been out there trying to do basic education around HR1, the magnitude of impact, what it means for Santa Clara Valley Healthcare and for the entire county government and our ability to provide services. We have a robust website with some really uh, uh, with some facts, some figures, timeline. It's going to continue to be dynamically updated. It's scc.info/federal funding. That's scc.info/federal funding. If you go to santaclaracounty.gov, you can link to it right away as well. But it's a dedicated site focused on these federal funding impacts. And like I said, it's going to continue to be updated. It'll continue to include information on our budget process. We are at the early stages of the planning around the upcoming fiscal year. That's the fiscal year that begins in July of 2026. As I mentioned, we also have impacts that are happening this fiscal year. And so we are going to be having a very difficult budget process, very, very difficult. These are public processes. People are very welcome and encouraged to engage. We'll be having public hearings. We publish the recommended budget on May 1st. That's all available online as well. The mid-year will be in February of 2026. That's when we make those mid-year adjustments. Normally, they're not that significant. This year, in order to keep the budget balanced, we have an obligation, unlike the federal government, ironically, we have an obligation to have a balanced budget, and so we'll be doing those adjustments then. So people should pay attention. We're going to continue to do community outreach related to that, hearings, forums. There was a really powerful public hearing just last week. We'll make sure you can put the link up related to that for your listeners, because it was a very powerful public hearing at our Finance and Government Operations Committee meeting that walked through from some of the key affected departments what H.R.1 means with some real excellent data and information. So we're trying to do those pieces of engagement, and there's a lot of good material out there, informational material that's available for people to understand what we're facing, what our strategies are, and to provide input and ideas, because this is a community crisis that affects every family in
Mhm.
the county.
Okay. Thank you. Thank you so much for your time. I really appreciate it. And we will continue on more
Absolutely.
budget
Thank you so
talks.
much for having me on, and for the thoughtful questions and engagement.
I can't seem to find the words to sum up this conversation because the impacts are so, so devastating. And the worst is yet, but very soon to come. Now, all of the resources referenced in our conversation are in our show notes. I also highly recommend you check out the Finance and Government Operations Committee meeting that was held on October 16th, 2025. It's on YouTube, and the link to that is in our show notes. One thing one thing I can say is that I am thankful for the 24,000 employees of the county, for James Williams, our county executive, and our board of supervisors, and all of the unsung heroes that make up the invisible infrastructures of our government. I want to say thank you to everyone. I know that they are trying with what means that they have to protect everyone and fulfill their duty to the residents of Santa Clara County. So thank you. Okay, the next episode is going to talk about what the county is doing in response to HR1, which is the 2025 Measure A that is going to voters and will be decided by voters on November 4th. This is a very important moment in this county's history. I hope that this episode provides you with a good preamble of why Measure A is going to the ballot and that you exercise your choice on Election Day. And as always, if you enjoyed this episode, please give us a follow, a like, a share, a review. It really, really helps. And if it's within your means, consider making a donation. All right, folks, until next time.